Hi, I'm Dr. Pedersen. Today we're going to go over rehabbing a golfer's elbow or a medial epicondylitis type of injury. You'll have the pain here on the medial side of the elbow, and usually it'll be very tender, point tenderness right there on the edge of the humerus. This is showing here kind of where the muscles that are involved in a golfer's elbow or medial epicondylitis are coming from. By the way, you do not have to be a golfer to have golfer's elbow. It's just commonly seen in golfers. So the muscles run here on your forearm, and they're the muscles that take and flex your fingers, grasping things, and also the ones that pull your wrist in for flexion, like this. First thing and first stage in the acute, very painful stages, is we're going to use ice. So you'll want to have a gel pack type of thing like this that you keep in the freezer, and we're going to put this right over the medial epicondyle, maybe wrap an ACE bandage around it. You'll want to do this 2, 3, 4 times a day for 10 minutes or so. This gets pretty lukewarm after 10 or 15 minutes. So if you're going to use ice, you'll want to put a layer of paper towels or something in there. We're going to put this there, and that's going to help reduce the inflammation. Part of the reason you have so much pain in this area is because it's very inflamed. The tendon has started to pull away from that bone, and that's what's causing the inflammation and pain there. Another thing that you're going to want to do in the initial stages of having medial epicondylitis is use something called a bandit. There's many different straps out there to go around the elbow. We find that this is the best one, and we do have these in our office, but you can get them other places. This is a compression strap which helps to reduce some of the tension coming off of the tendon where it meets the bone. But the good thing is that it only is compressing at the muscle bellies themselves. It is not compressing throughout the whole thing, and where it's not compressing is where the nerve and blood vessels are. That means that you won't get tingling and stuff into your hand if you get it too tight, and also the blood, which is carrying the healing nutrients to that area of your arm, will be able to flow. This is pretty easy to put on. We just loosen it up, and you're going to put it over the areas of the muscle. Very important in a medial epicondylitis golfer's elbow type injury. We're going to put it about this many forefinger widths down from the elbow, and we're going to put it around that big muscle, wad of muscle that's there in the front of your arm. So, and then we'll just tighten down on this, like this. That should be pressuring there, and when you go to grasp things or things that would normally cause pain at your medial epicondyle, that should not feel as bad, or you shouldn't feel pain at all. That doesn't mean you should go out and try and find pain, but anytime you have pain in this, either in a tennis elbow or a golfer's elbow, you're re-tearing those fibers of the tendon away from the bone, and it means it's taking you farther away from healing. So something I tell my patients, it's very important to not do anything that causes you pain. If opening a jar causes you pain, get someone else to open the jar. If you're trying to use a hammer and that's causing you pain, each time you're swinging that hammer, it's taking you farther away from healing. If we can really aggressively go after it with the stuff we're going to talk about in this video for even a couple weeks, we can get a great handle on this and get it to heal quickly. If we continue to do things that bother it, we take 4 steps forward and 3 5/8 steps backwards. That means we're not going to progress very quickly. So anyways, the first part of the rehab exercises is we're going to do stretches, and we're going to stretch both sides of the forearm. What we're going to do is bring your fingers up and extend here, pulling back. You want to make sure that your elbow is extended right here. Very important. You don't want your elbow bent. You should feel the stretch on the bottom part of your arm here. Just do a gentle stretch. We want to do that for about 15 to 30 seconds. And do a few sets of that. You can do this numerous times throughout the day. It's very good, and stretching is a first key component to helping this to heal. Then we want to do the opposite, where we're stretching the extensor muscles of the forearm. Again, having the elbow extended and flexing at the wrist. If there's any acute pain with this, we need to go back to the stage of wearing the brace, the bandit brace, and using an ice pack. All right. Okay, so for this portion of the exercises, what we're going to do is you're going to be strengthening the forearm muscles. We're going to start with a weight. This is a 3-pound weight here, something very light, even a soup can, something like that. In the hand, we're going to support the forearm on the knee. So we want to make sure that it's out far enough so that the wrist can move through a full range of motion. And then we're going to slowly let the weight down. Good. And then slowly bring it up. Doing that. And actually, we can go a little bit faster on the way up, but making sure that on the way down, very, very slow. So again, up and then slowly down. It is very important that you have a controlled phase, maybe counting to 3 on your way down, because that is what helps you prevent getting injured in the future. That's called an eccentric contraction, meaning a lengthening of muscle as you contract it, different than a shortening of muscle as I contract it. Most injuries happen with eccentric loading of muscles. So doing 15 to 20 of these, good quality ones. The elbow can be bent, or should be bent. And then we're going to flip the arm over. And again, resting it on the knee here. And we're going to be doing the opposite exercise, bringing the wrist up and then bringing it back down. Perfect. Bringing it up again and back down. Slowly bring it down. You might notice that it ratchets a little bit. That's normal when the muscle is weak, especially when it's weak in the eccentric contraction, which is what we're trying to help. You can slowly increase weight, but you need to make sure that you're doing these, that they aren't causing pain, and that you're able to do good form with this. Okay. How's that feel? One other thing that we're going to do, this helps you with tennis elbow and also with golfer's elbow. And the key to what I'm trying to do for my patients in the office is not just help them get fixed from their initial pain that they came in with, but making sure that the musculature around the forearm and wrist is balanced so they prevent in the future wrist injuries or golfer or tennis elbow. So there's nothing worse than having someone that had tennis elbow and then 2 months later they've got golfer's elbow and they wonder if they should just get a new elbow. So what we're going to do now is a rubber band exercises for your wrist extensor and finger extensor muscles. We very often are grasping things, and this is kind of a mechanism of injury for our golfer's elbow. But we need to, muscles never work by themselves. They always work in pairs and in tandem with other muscles as synergists and antagonists. So when we are trying to fix this muscle, we need to fix the antagonist to make sure that they have a good balance between them. So what we're going to do is open the fingers like this slowly and then close, open and slowly close. And this is a medium-sized rubber band. Just any time that is safe and convenient and you're not busy doing something else, talking on the phone, great exercise to do. Helps to strengthen these muscles, the finger extensor muscles. So you can see.